Okay, let's imagine this. Your dog, usually full of beans bouncing around, is just, well, flat today, maybe panting a bit weirdly. You go to the vet, and suddenly they mention lactic acid. Huh, something maybe you remember from high school biology. But now it's about your pet.
Exactly. And if you're hearing that term, you're probably wondering what it really means.
Yeah, definitely. So today, we're doing a deep dive into exactly that, lactic acidosis in dogs and cats.
Right. So when your vet talks about lactic acidosis, they're describing an imbalance, essentially. You've
Hmm.
got higher levels of lactate in the blood, and often that means the body's pH is dipping, becoming more acidic. We've been digging into the veterinary literature, the expert guidelines, to really unpack this.
Yeah, because let's be honest, medical jargon can be pretty intimidating. So our mission here is to cut through that, make it clear. Think of this as like your shortcut to really understanding what lactic acidosis means for your pet's health. I'm here asking the questions, trying to connect the dots.
And I'm here to bring in that clinical perspective, help explain the why behind it all, why it matters for you and your pets.
Great. So let's kick off with the fundamentals. What's the deal when a vet says a pet has high lactate?
Okay, so the technical term is hyperlactatemia. For dogs, older than maybe 70 days, so past that early puppy stage, we usually say anything over about 1.5 millimoles per liter is high.
1.5, okay. And cats?
Cats, the threshold is a little higher, generally above 1.8 millimoles per liter. But, and this is really key, just having high lactate, that hyperlactatemia, isn't automatically lactic acidosis.
Ah, right. So what's the difference, though?
Lactic acidosis is when you have those high lactate levels, plus you've confirmed the blood pH, specifically arterial blood, is lower than normal, more acidic.
Gotcha. High lactate plus low pH equals acidosis. But where does lactate even come from? Is it always bad?
No, not at all. Lactate is actually a totally normal byproduct when the body makes energy from glucose. Happens all the time, whether there's plenty of oxygen around or not so much.
Like when we exercise really hard, that burning feeling?
Exactly like that. That's lactate building up in your muscles when they're working anaerobically without enough oxygen. Similar things can happen inside a pet's body during, say, shock, or even during intense seizures.
So, a little bit is fine. Normal, even.
Totally normal. The body's actually really good at handling it usually. The liver and the kidneys, they're the main players.
Yep.
They process lactate, clear it out. They also do other vital stuff like making glucose for energy and keeping that whole acid-base balance stable.
Right. So the problem arises when that system gets overwhelmed or production just goes way up.
Precisely. When an animal is sick or maybe injured, a super common reason for lactate to shoot up is that the tissues just aren't getting enough oxygen. We call that tissue hypoxia.
Hypoxia, lack of oxygen.
Yep. But when cells are starved for oxygen, they have to switch to that less efficient anaerobic energy production. And that process churns out more lactate. So for what we call type of acalactic acidosis, it really boils down to an oxygen delivery problem.
Okay, and what kind of things stop oxygen getting where it needs to go?
Oh, several things. Poor blood flow is a big one. Inadequate perfusion, that's the term.
Huh?
Think shock,
Yeah.
Or if the blood itself is low on oxygen, severe hypoxemia, maybe from serious lung issues. Sometimes the body's oxygen needs just skyrocket beyond supply. And low red blood cell count, severe anemia, means less oxygen carrying capacity. Often it's a mix of these factors.
So, high lactate, does it always mean bad circulation?
Not necessarily, no.
Yeah.
You can have hyperlactatemia sometimes even when the circulation seems okay on the surface and the body's buffering systems are still managing the pH. We even talk about occult hypoperfusion.
Occult, like hidden.
Kinda, yeah. Meaning there might be subtle oxygen issues at the tissue level that aren't obvious yet, but could be an early warning. But when those buffering systems, think of them like sponges for acid, get totally swamped by all the acid produced alongside the lactate, that's when hyperlactatemia tips over into lactic acidosis.
And I guess the level matters, like how high the lactate is or how low the pH.
Absolutely. Generally speaking, the higher the lactate and the lower the pH in a really sick animal, the more serious that underlying oxygen deficit probably is.
Yeah.
Human studies, especially in trauma and shock, show lactate is a really strong predictor of outcome. Higher lactate often means higher mortality risk.
Wow.
And we're seeing very similar things in dogs, critically ill ones. A big persistent jump in lactate that's often linked to a poorer prognosis. So measuring it gives vets a really valuable snapshot of how sick the pet is and, crucially, how they're responding to treatment over time.
Okay, so it's clearly a serious sign. But what does it actually do to the pet's body? Why is it so harmful?
Yeah, so persistent lactic acidosis really hammers the cardiovascular system. It can weaken the heart muscle itself that's impaired cardiac contractility,
Mm.
make it harder to pump.
Right.
It can also make the body less responsive to its own stress hormones like adrenaline, which normally help keep blood pressure up. That's the impaired pressure response.
So the body's own rescue mechanisms don't work as well.
Exactly. Plus, it increases the risk of dangerous irregular heartbeats, ventricular arrhythmias. And ultimately, it reduces the total amount of blood the heart pumps out, the cardiac output. And you can see how all that just makes the original oxygen delivery problem even worse. It's a vicious cycle.
Man, that sounds rough. Does it affect other things too?
It can, yeah. You can mess with blood clotting, potentially leading to bleeding issues, hemorrhagic complications, especially risky after surgery or trauma. And, the worst case scenario, if the acidosis and the hypoxia are severe and ongoing, it can spiral into multiple organ failure and potentially death.
That's grim. So are certain pets more prone to this, like specific breeds or anything?
Not really breed specific, no. Any dog, any cat can potentially develop it. The signs an owner might see at home are usually tied to the underlying problem causing the acidosis, not the acidosis itself, if that makes sense.
Yeah, like symptoms of whatever illness started it all.
Right. But as things get worse, you might start seeing signs from almost any organ system because it's such a systemic problem.
Are there clues in the pet's history that might make a vet suspect acidosis?
Definitely. If there's a history of shock, severe infections, maybe exposure to certain toxins, or even diseases like cancer, those things would raise suspicion. Basically, any situation that could compromise oxygen delivery is a potential red flag for acidosis.
And what about on physical exam? What might the vet find?
Fast breathing tachypnea is common. The body's trying to blow off CO2 to counteract the acid. Signs of dehydration and poor perfusion are big ones too. Maybe pale or muddy-looking gums, slow capillary refill time.
And that's when they press on the gum.
Yeah, and see how fast the pink color comes back. Increased skin turgor, where the skin stays tented when you lift it, shows dehydration. And in really bad cases, you might hear an abnormal heart rhythm or feel a weak pulse.
Okay. So we get what it is, why it's bad. You mentioned type A and type B causes earlier. Can we break those down?
Absolutely. It's a helpful way to think about it. Type A is the most common, and like we said, it's all about inadequate oxygen delivery. Poor perfusion, tissue hypoxia. That's the core of type A.
Right, oxygen problem. Examples.
Shock is the classic one. Hypovolemic shock from blood loss. Cardiogenic from heart failure. Septic from infection. Also, localized issues, like if the blood supply to the gut gets cut off, like in GDV or torsion, blocked arteries, severe lung disease causing low blood oxygen, severe anemia.
Carbon monoxide poisoning?
Yep, that too, because CO stops oxygen binding to hemoglobin. Even things like really severe asthma attacks or prolonged, intense seizures can push an animal into type A.
Got it. All directly hitting oxygen supply or use. What about type B then? That's the other category.
Pretty much. Type B covers lactic acidosis happening without that obvious widespread oxygen shortage. It's a bit more diverse.
But like what?
Certain cancers can be associated with it, lymphoma, sometimes meningioma, for example. The exact why isn't always crystal clear, but finding high lactate in a cancer patient definitely warrants a closer look at perfusion, just in case.
Interesting. What else?
Severe alkalosis, the opposite of acidosis. High blood pH can sometimes trigger it, weirdly enough. Widespread infection, sepsis is a big one that can have elements of both type A and B. Kidney failure, liver disease, remember they help clear lactate.
Right.
Certain drugs too. High doses of catecholamines like norepinephrine, epinephrine. And then there's a list of toxins. Ethylene glycol antifreeze is a classic. Strychnine, cyanide, even high doses of things like salicylates, acetaminophen, propylene glycol.
Propylene glycol, isn't that in some pet foods or medications?
It can be, yeah, usually in small amounts, but in large amounts or in susceptible animals, it can be a type B cause. And again, with some type B causes, you might still have that occult or hidden hypoperfusion going on at the micro level.
Okay, so that's a lot of potential causes. If a vet suspects acidosis, how do they actually diagnose it and figure out which type it might be?
Well, any really sick or injured animal, you should probably have acidosis on your radar. Measuring lactate is a key step, but interpreting that number, you need context.
The context,
Like remembering certain things can bump lactate up without true hypoxia. We mentioned some drugs already. Activated charcoal, if given for toxin ingestion, can interfere. Even the type of blood tube used matters. Sodium citrate tubes might read a bit lower than heparin or EDTA.
Oh, interesting. Consistency is probably key then.
Definitely key for monitoring trends. Also, if the vet's getting IV fluids that contain lactate, like lactated ringer solution, you need to make sure that's been metabolized before you rely on a lactate reading. Don't want to measure the fluids.
Makes sense. What about just stress, like the stress of the vet visit?
Oh yeah, big time. Stress, excitement, struggling when they're trying to get blood, even just squeezing the limb too tight, that can all cause a temporary, usually mild, increase. It should come back down within an hour or two, usually.
Okay. And seizures, intense activity.
Same thing. Can cause a transient spike from the muscle activity. Should normalize fairly quickly. And don't forget those type B causes we listed: cancer, alkalosis, sepsis, liver, kidney disease. They can cause sustained elevations for reasons other than just poor oxygenation.
So it sounds like one normal lactate reading doesn't automatically mean everything's perfectly fine everywhere in the body.
Exactly. That's a crucial point. You could have a major issue in one specific area, like poor blood flow to the intestines, that hasn't yet spilled enough lactate into the general circulation to raise the systemic level.
Yeah.
But that localized problem is still really serious and can lead to bigger issues down the line.
Right. Lactate is one tool, but not the whole toolbox. What other tests are usually run alongside it?
You definitely need baseline blood work, a CBC, chemistry panel, and a urinalysis. Those help pinpoint the underlying cause. You might see kidney changes with ethylene glycol, or signs of dehydration and electrolyte shifts and shock. An arterial blood gas analysis is super helpful, especially if you suspect breathing problems are involved, or if you think there might be a mix of acid-base issues happening. And then, depending on what you suspect, you might run specific tests, like an ethylene glycol test, check glucose, look for ketones if you suspect diabetic ketoacidosis. It's all about building the full picture.
Okay, picture built. We know or strongly suspect what's going on. How do we treat lactic acidosis?
So first off, just finding high lactate alone. If the pet otherwise seems stable and doesn't show signs of shock, doesn't automatically mean you jump to treat the lactate itself. It's a warning sign, right? Makes you look harder for the why. Giving fluids just for high lactate isn't necessarily the move.
So the focus is still on fixing the underlying cause.
Absolutely. Finding hyperlactatemia, with or without the acidosis part, should always trigger that hunt for the cause, usually looking for poor perfusion. And it prompts early action to improve oxygen delivery, trying to head off shock before it gets worse.
But if you do have full-blown lactic acidosis, high lactate and low pH?
Then yes, you often need to be aggressive. Treat the underlying cause, definitely, but also provide direct support to help correct the acidosis itself.
And what does that support look like usually?
Intravenous fluids are almost always step one, especially if there's dehydration or low blood volume. Aggressive fluid therapy.
Any particular type of fluids?
In hypovolemic lactic acidosis due to low volume, there's some thought that using alkalinizing fluids, like those containing bicarbonate precursors, or even just pH-neutral fluids, might be better than standard, slightly acidic fluids like saline. Help nudge the pH back up.
What about giving actual bicarbonate, like directly adding alkali?
Sodium bicarbonate, that's controversial. It's generally reserved for really severe cases, where the arterial pH is dangerously low, say below 7.2, and isn't getting better just with fluids and fixing the underlying issue.
Why controversial?
Well, there are risks. If you give it, it has to be done incredibly carefully, calculating the dose precisely, or giving small amounts and rechecking the pH very frequently.
What are the risks?
Several. You generally only use it if pH is below 7.2, because pushing it too high can cause its own problems, especially cardiovascular ones. The goal isn't even to normalize the pH, just get it back above that critical 7.2 threshold. It might not work as well in the type of acidosis usually seen with high lactate. You can cause fluid overload. There's a risk of paradoxical acidosis in the brain, where the brain gets more acidic. It can drop calcium levels, affect how oxygen binds to hemoglobin.
Wow, okay, so definitely not a simple fix. Needs extreme caution.
Exactly. Powerful tool, but needs very careful consideration and monitoring.
So once treatment starts, how do you know if it's working?
This is where serial lactate measurements are golden. Checking it repeatedly over time tells you so much more than a single value. Seeing that lactate level come down, that's usually a really good sign. It suggests you're getting the underlying problem under control and the pet's chances are improving.
Makes sense. Look at the trend.
Look at the trend. And of course, you keep monitoring everything else relevant to the underlying disease: heart rate, blood pressure, breathing, urine output, all of it.
And for pet owners listening, what can they do going forward if their pet has gone through this?
Learning the early warning signs of whatever condition caused the acidosis is key. Knowing when to get help quickly if those signs reappear. And it's important to have realistic expectations. Animals that develop lactic acidosis are often very sick. They're at a higher risk for complications like organ failure, and overall mortality is higher. sadly.
Especially if the lactate is really high.
Yeah, very high levels, say consistently over 6 or 6.5 millimole. That often points to severe, widespread hypoperfusion or maybe even tissue death somewhere, like with a twisted stomach, GDV.
So, quick correction, good sign. Persistent high lactate, YOL's bad sign.
That's a pretty good summary. If the acidosis resolves quickly with treatment, it suggests the primary issue is resolving. If it stubbornly stays high despite everything you're doing, that's a very serious prognostic indicator. So tracking both lactate and pH over time really helps predict the likely outcome much better than just one snapshot.
Okay, this has been incredibly clarifying. So if we had to really boil it down, the main takeaway is...
The main thing is, lactic acidosis isn't really a disease itself. It's a sign. A really important signal that something significant is wrong deeper down, usually related to oxygen delivery or how the body is using energy. It's a big red flag.
A red flag that needs investigating.
Exactly. And it just highlights why getting prompt veterinary care is so crucial when your pet seems unwell. Measuring lactate is such a valuable piece of the puzzle for vets, helps with diagnosis, figuring out severity, and tracking response to treatment.
It really makes you think, doesn't it, how one number, lactate, can reflect so many different potential underlying problems. You start wondering what other simple lab values might be telling these complex, vital stories about our pet's health. Definitely something to ponder.
That's a fantastic point. It's absolutely true. So often those numbers on the page represent intricate biological processes, and understanding them helps us provide much better care.
Well, hopefully this deep dive has helped shed some light on lactic acidosis. If you listening have more questions or experiences related to this, definitely chat with your own veterinarian. It's all about learning more to help our animal companions. Thanks for joining us today.